us come to again the conclusion. The conclusion of this particular study is ARNI treatment resulted in significant reductions in NT-proBNP levels in heart failure patients under and over 80 years of age with comparable discontinuation rates. These findings highlight the effectiveness and safety of ARNI in the management of chronic heart failure in the elderly, offering very good, and of course the studies from Japan where the elderly population is very high. Our own experience is that the postural hypotension with ARNI is higher in patients above the age of 75, especially if you cross 100 milligram BD of ARNI. So we are careful that above the age of 75, we are very reluctant to try and touch 200, though that is our goal. I would now like to have comments on how do you handle postural hypotension in this elderly group of patients, which is quite specific for them.
So this study is from Japan. So Japan, where the longevity, the lifespan of people is around more than 90 years. And in India, it is 69 years. And the Indian patients, they become very frail when we reach their 80s. So this octogenarian population and how much relevant this is for our population, it's a little kind of debatable. But of course, our 70s is their 80s as per the physical agility is concerned. So in 70s, if we go, so we have to start with the lowest dose, 25 milligram twice daily. I'd start there, and definitely I would not be very happy taking them altogether 200 twice daily. And we have to be careful about diuretics and postural hypertension, and we have to counsel patients to get up very slowly from the bed, and these all precautions should be given. So Dr. Nishant, what do you say, octogenarians and ARNI uses? How many of your patients are in 80s and taking ARNI?
Very few patients actually, but yeah, I have given it to one of the colleagues' doctor's father. He was taking till the age of 94 and was tolerating it very well. So it is very well tolerated. Just you have to look for more carefully to the electrolytes, blood pressure, and the KFT.
Yeah. So dropout rate is 12% in this trial, more than 80 years, and less than 80 years is 6%, 7%. So it becomes almost twofold. Dr. Kalyan Raman, how many of your patients of more than 80 years are there who are on ARNI?
I don't have any patients in that age group, particularly the ARNIs.
Because our life expectancy is less, so Indians, after 75, 80, the deal of living also becomes less. So I always tell patients that you see Donald Trump is 85 years, is contesting for presidency. So you also have more opportunity. So it's never to get disheartened and hopeless about the age.
It's interesting. Only 20 years ago, or 25 years ago, I operated a 75-year-old and everybody was laughing at me that I offered CABG to a 75-year-old. And now, in Mumbai, to operate on 80 to 85 is actually become fairly common. But I think this has something to do with the socio-economic improvement in, at least in metros. Yes. So I offered surgery to 85-year-old. The family takes it for granted that it's a usual case and everything is routine. So I tell them that, look, though we are doing serum creatinine and carotid assessment, but a 80-year plus is a 80-year plus. But somehow the acceptance for surgery has actually risen very high in metros. And so for us to operate on 80 plus is actually become routine. And none of them seem to be frightened. I am frightened, but the family doesn't appear to be.
Yeah, no, I have one point here to make. So it's not about years. Okay, that is also another point. But what I see in India, the patients who are diabetic, the proportion is higher. And yes, comorbidity is higher. By the time they reach 80, 85, they get some renal compromised. So GFR becomes around 20, 22, 25, and something like that. And that is real concern for this polytherapy. And then ARNI also comes there and how to do. So that is the basic reason of your hesitation in adding those patients. But definitely those patients who are good require surgery. I did a pacemaker of a patient who reached 100 years. In 101st year, I did a pacemaker, and that was the news in Calcutta. So yes, our socioeconomic condition is changing, and maybe it's getting better day by day.